For a long time, cancer has been seen as a death sentence, but increasingly, experts tell us it does not have to be so. They insist that a large portion of the cancer burden worldwide can actually be prevented or managed with resources already within reach. What then must be done to reduce the big C to a little or non-existent C in the coming years? Find out in this interview with Dr. Abia Nzelu, a surgeon and the Executive Secretary of the Committee Encouraging Corporate Philanthropy. You're welcome to the show, Dr. Abia Nzelu.
Thank you very much.
When somebody has cancer, what has really happened in the body? What went wrong?
So when the person has the cancer, the building block of the cell has a problem with the DNA. So when there's damage to the DNA, which usually controls the normal growth of that cell, the cell starts growing out of control.
Does cancer have common symptoms? All the cancers, do they have common symptoms?
Generally, cancer does not have symptoms in the early stages. So it's like a chronic disease. It doesn't have symptoms in the early stages, but in the when it becomes advanced, there are some general symptoms that are common to most cancers, and one of them is swelling. Swelling in any part of the body that is persistent and is growing, is increasing in size, is an indicator of cancer. And then other ways it can present as it's growing is that the person may always be feeling tired. So that's when it is advanced. That's one way cancer can present, and it's commoner in some cancers like leukemia and blood cancer. And when the person's blood level becomes low, the person you may be appearing pale. And then, of course, bleeding from any part of the body can be a pointer to cancer. For instance, vaginal bleeding, abnormal vaginal bleeding in between periods or following intercourse and all that can be a pointer to cervical cancer or some endometrial cancer, cancer of the womb and all that. And then bleeding from the nose can be due to cancer from any that area, part of the body, the nose and the respiratory tract. Bleeding, seeing blood in the urine may be a pointer to bladder cancer, or passing blood in the stool, maybe a pointer to cancer of the colon, cancer of the stomach. So, and bleeding from any part of the body that is persistent. In fact, even if you just notice bleeding once, that abnormal bleeding, you need to go get investigated.
How about pain?
Pain is a very important symptom of cancer. But the thing about pain is that for some cancers, you may not have pain in the early stages, which is why many people get picked up very late. For instance, breast cancer.
What are the most common cancers in our own country, in Nigeria?
Like we said, cancer can occur in any part of the body, but there are some that are very common. And for instance, in women, the most common cancer is breast cancer. And then you have cervical cancer, which is cancer of the neck of the womb, the outer part of the womb. Now, for breast cancer, in Nigeria, as we speak, every day, 40 women die of breast cancer, according to the latest data from WHO. The previous data, 4 years before these statistics, was that 30 women die every day of breast cancer. Now it has increased to 40. Now, cervical cancer is the next common cancer in women, and it has reduced from 26 to 22. That shows us that there's a lot we can do, and we can really do something about cancer. And what led to it? Around 2007, the Mass Medical Commission initiated the National Cervical Cancer Prevention Program. This is a non-governmental initiative to do something about cervical cancer, because it's virtually 100% preventable. So why should any woman be dying from it? And so that was why the campaign started against cervical cancer and introduced mass screening.
What about for men?
Now, for men, the most common cancer is prostate cancer. That's cancer of the prostate, and it's one cancer that we really have a lot to do. The previous statistics were that 14 men used to die of prostate cancer. Now it is 26 men. So yes, every day. So it has almost doubled from 14 men dying every day to 26 men. And it's not surprising because, you know, most people associate cancer to women. So once you hear cancer, it's just the first thing that comes to the mind of anybody is breast cancer.
Cancer is usually seen as a death sentence. When you have it, it's over. Why the tag "not beyond us"?
The reason why they say not beyond us is just for us to know that there are a lot of things that we already have in place that can help us reduce death from cancer. So we don't really need all those highfalutin things. Most of the research has already been done, a lot of studies have been done, so we have a lot of advances in cancer care, cancer prevention. So with what we already have, we can reduce the death rate from cancer. Cervical cancer is one cancer that has a pre-cancer stage. And so because of that, it is 100% preventable because it takes years, up to 5 to 20 years before the changes that lead to cancer eventually lead to cancer.
Can you mention the cancers with pre-cancer stages?
Not all cancers have pre-cancer stage, but you have some. For instance, breast cancer doesn't have pre-cancer stage, it just comes as breast cancer. But of course, you can pick it up very early if you do your mammogram. So mammogram is already in existence. So we already have the things that we need. In the United States, breast cancer or cancer generally used to be a death sentence. Before all these studies started, the research advocacy by the American Cancer Society, and then we now have all these advances. With mammogram, the breast cancer rate has reduced drastically in the United States. Out of every 7 women that have breast cancer, only 1 will die. 6 will survive. That is with what already exists. So if we put that in place in Nigeria, we will know that we will see a drastic reduction in all these deaths. Because for instance, if we have a system of getting mammogram accessible to most Nigerian women, you'll find that there will be serious reduction in the death rate from breast cancer because mammogram can pick breast cancer up to 2 years before it becomes palpable, before you can feel it with the hand. So when it is still very small, you can pick it up. And so if you pick it up at that stage, it is curable. So that's why they say it is not beyond us. Cervical cancer, with screening, regular screening, you can pick the pre-cancer stage. The screening takes about 5 minutes screening. And then the treatment, and of course it is painless. The treatment of the pre-cancer stage is about 15 minutes. You come for the treatment, 15 minutes, it is over, you go back home. And because of that, for want of doing that in a large scale, most Nigerian women are dying unnecessarily from that condition. You also have colon cancer, which usually starts as a polyp most of the time. So with colonoscopy, you can see the polyp. And if you find that polyp, you just clip it off on the spot. You don't need a separate procedure to treat it. And that is the end of colon cancer.
You make it sound so easy. What are the challenges you face? Because we are not there yet.
The roadblock is where we need to have the infrastructure and we need to have the political willpower, the involvement of everybody. The thing is that with cancer care or cancer prevention, it's not something that you leave to one sector of the society. You say, okay, it is government or it is this or that. It is something that involves every part of the society. And unfortunately, we find that we don't have that togetherness when it comes to cancer prevention.
Now, when you discover cancer at the early stage, like the colon cancer you were speaking about, and it's clipped off, does the person have to go through radiotherapy, chemotherapy?
That pre-cancer stage doesn't need radiotherapy, it doesn't need chemotherapy. It's not cancer yet. So you just clip it off. That's all you need to do. The person doesn't have cancer, so you don't need all that. It is only when it is not cancer that you will need all that. For cervical cancer, all you need is cryotherapy. You don't need to do chemotherapy, radiotherapy for that. It is only when it is established cancer that you now need all those expensive and traumatic treatments.
What are the healthy life choices that people can make to reduce the risk of getting cancer?
Exactly. So most of these cancers they are related to your lifestyle, the lifestyle, and some of the healthy lifestyle that people need to adopt to reduce the risk of most of these cancers, breast cancer, colon cancer, and all that, include exercise. Regular exercise will help you to reduce your risk of cancer. not smoking. Smoking contributes to like 30% of cancer globally. So if you stop smoking, and you know, smoking is not just the person that is smoking that is affected. Those that are around, so second-hand smoking, third-hand smoking, all those things, we need to look into them. So you should stop smoking, and then if you must smoke, you shouldn't smoke in public places so that you will not expose others. And unfortunately, apart from smoking, you also have all these exhaust fumes from diesel generators and all that. They also contribute. And that's why you find somebody that has never smoked having lung cancer. And then, of course, alcohol. Excessive alcohol intake can increase people's risk of cancer. So people should stop taking alcohol if possible. If not possible, reduce their intake of alcohol as much as possible. Your diet also contributes. You should take more of fruits and vegetables. Take a lot of fruits and vegetables, and reduce our intake of red meat. Take more of fish, chicken. Those are healthier than red meat. And then your weight. We have to watch our weight, because when people that are obese tend to have a higher risk of cancer. And when we talk about these lifestyle changes and talking about risk, it doesn't mean that if you are exposed to all these factors we're talking about, that you must have cancer. Another important lifestyle is the lifestyle of regular checkup. So we all need to do our screening as recommended, depending on the kind of cancer. For instance, for cervical cancer, from the age of 18, any young woman should start doing screening, and then that's in our environment. Abroad, they may say 20, 21, but because of our circumstances, from 18, we should start doing our screening, and it should be done yearly, on a yearly basis. That way, you're likely to pick up the pre-cancer stage. For breast cancer, at 35, you should do the first mammogram. If it is normal, you wait until you're 40, and then you now start yearly mammogram.
I'm wondering how affordable this can be with all these screenings that have to take place.
Exactly. That's why we say we should have a system of reaching the people. And that's why we talk about the mobile cancer center. Because if we have a mobile cancer center, the mobile cancer center has facilities for most of these common cancers. The mammogram will be there. Colonoscope, that I say is also readily available, will be inside the mobile cancer center. Sonogram will be inside the mobile cancer center. You can use that for ovarian cancer, prostate cancer, even for breast cancer, depending on the age of the person, and some other conditions, even for the abdominal cancers. Then you have facilities for treating the early cases. In that mobile cancer center, you have the cryotherapy and all that you can do. So you can do, when you pick up the early cases, you can treat them inside the mobile unit. Yes, and then you have a laboratory there where you can also do other tests for things like diabetes, which are also risk factors, hepatitis. Hepatitis is the major risk factor for liver cancer in our environment, and it's one of the common cancers we have here. Malaria is the risk factor for the most common cancer in children, called Burkitt lymphoma. So you have a lab where you can do all these tests and screen for all this, including kidney disease, which also is a risk factor for cancer. So when you have that system, and then we have people coming together to make it available, you find that we cannot reach the people with screening in the grassroots without paying anything.
Are there other infections, apart from the ones you mentioned, that predispose people to cancer?
Yeah, there are numerous ones. Like, for instance, you have the Helicobacter pylori, which is a risk factor for, it causes stomach cancer, and eventually can lead to, it causes stomach ulcer, and then it can lead to stomach cancer. So that's another one. Then you have what we call schistosomiasis. That's a kind of infection that can affect somebody, and then in childhood, and later on lead to bladder cancer. Fortunate thing about this is that the treatment for that condition is simple, by just 2 doses of a drug, and that drug has been donated by the company that manufactured it free of charge.
What immediate things can the government do to set things rolling in the right direction?
Now, by supporting this campaign that is ongoing, we need to have a system of reaching the people in the grassroots. Those that can travel abroad can decide to travel abroad for their own screening and all that, but it's not even necessary We can do that if we have the right structures.
Thank you very much, Dr. Abianzelu, for coming on Health News.
Thank you for having me.
We've come to the end of the show. Thanks for staying with us. From me and the rest of the crew, stay healthy and make informed decisions. I am Mary Alale Yusuf.